How to care for your SecureLoop advanced drainage tube fixation device. SecureLoop has two fixation mechanisms. The blue locking ring serves as the primary fixation, and the cable tie locking system provides secondary fixation to help keep the drainage tube securely in place. When changing the absorbent pad, do not cut or release the cable tie locking system, as it maintains drain stability during dressing change. How to change the absorbent pad for your SecureLoop. First, locate the two unlock buttons on both sides of the blue ring. Press and hold both unlock buttons. At the same time, rotate the blue ring anti-clockwise to loosen the inner hoop band. Next, using a sterile forceps, carefully remove the soiled absorbent pad. Clean the drain or catheter insertion site using an appropriate cleansing solution, following your hospital's wound care protocol. Before applying a new absorbent pad, make sure the insertion site and surrounding skin are clean and completely dry. Next, open a new sterile absorbent pad package. Place the absorbent pad inside the blue ring. Make sure it sits flat and is in direct contact with the skin around the drain insertion site. Lastly, rotate the blue ring clockwise to tighten the inner hoop band. Once the hoop band is in contact with the drainage tube or catheter, continue rotating the blue ring an additional 30 to 60 degrees to secure fixation. What should I do if I accidentally over-tighten the hoop band? Firstly, press and hold both unlock buttons. At the same time, rotate the blue ring anti-clockwise to loosen the inner hoop band. Next, rotate the blue ring clockwise until the inner hoop band is securely tightened. How to remove SecureLoop. To remove the SecureLoop, first press the two unlock buttons on both sides of the blue ring. At the same time, rotate the blue ring anti-clockwise to fully loosen the inner hoop band. Next, use a forceps to remove the absorbent pad. Lastly, gently peel off the PSA dressing together with the drain or catheter to ensure complete removal.